Well, first of all, Dr. Lazarus, thank you very much indeed for taking the time to talk to us.
My pleasure.
Busy week.
Busy week.
So give us an insight into what you'll be talking about tomorrow about happy physicians.
Well, tomorrow we're going to be doing a roundtable on the work that the AMA is doing currently and in the future to try to assess what makes physicians feel better about practicing medicine, as well as what makes their practice more sustainable. So what we've done is we've done a deep dive in terms of research in different physician practices, ranging from individual, small, solo practice physicians, all the way up to big multi-specialty groups, to find out what kind of practice situation makes them feel good about practicing medicine and what kind of tools and services that they might need to help them practice more efficiently. Because what we hear from physicians is how difficult it is to practice, the administrative hurdles they have to go through, the time that it takes away from the actual taking care of patients. And what rose to the surface in the kind of research we did was tremendous frustration with electronic medical records.
Right.
So the purpose of the roundtable is to provide an update on what that research has shown, as well as give a preview of the kind of tools and services that the AMA is hopeful to have available for physicians to make them have their practices more efficient, as well as provide more time with their patients.
It's sort of very important, isn't it? Because you think all the time, not only the role that physicians play, but the time it takes to train and to bring a physician to the level of skill that they have, that you keep them motivated and engaged with treating their patients.
Sure, and the fact is that physicians now feel stressed because of this additional work. And if there are tools and services or teaching, that educational tools that we can give to physicians to improve the stress in their lives, improve their practices so that they are happier in their practices, they'll actually do better with their patients also.
What kind of time scale are we looking at?
Well, we're looking at a series of tools and services that are going to be coming out over the next several months and then more into the future. Many of these will be aimed at especially the small practitioner who doesn't have the scale and the capital to invest in a number of these services. But also some of them will be available for the larger practices also. But they're going to be rolling out fairly soon.
Now, you're a immediate past president of the AMA, and if
Correct.
I remember rightly, you're the first psychiatrist to have that role for quite some time.
Correct.
1939. Everybody's talking about integrated care this week. How does that work with the work that you're doing on happy physicians?
Well, I think it's very clear that we're not going to have enough physicians going to the next several decades, especially with millions of people getting insured now. I think we are thinking that we need to find models of team-based integrated care where the physician can be working at the top of his or her license and work with others to provide certain services that ordinarily a physician wouldn't need to provide. And that teamwork can also provide better coordinated care, keep track of patients better, and actually improve patient outcomes.
You touched on a very important point there, didn't you, with the Affordable Care Act. We should be having more patients, shouldn't we, for physicians to treat?
We should. We'll have plenty more.
So this work is even more important.
Absolutely important, because as we scale up the number of patients who are going to be coming into physicians' offices, we have to be able to provide services for them in a way that will actually benefit them over the long haul.
Well, Dr. Lazarus, thank you very much indeed for talking to us. We appreciate it.
Thank you.